Hello, welcome to the audio lecture for chapters 9 and 10. So in chapter 9, we're going to start by talking about hospitals. As you know, hospitals are the center of health services system. We have to have hospitals in addition to physician offices because there are situations in which patients have to go and have extensive procedures done that can only be done at a hospital. And after having that particular procedure done, they may have to remain in the hospital for X amount of days or X amount of weeks or maybe even months. There are times when patients may come from the emergency room and admitted to the hospital and monitored for 24 hours, 48 hours. We call those observation patients. So there again, there are several reasons why we have to have the hospitals. In addition to having physician offices. So with that being said, because we have hospitals, that requires more workforce personnel. So yes, hospitals are a major training site for employees as well. Much more extensive training is done in a hospital setting because of the vast majority of duties that has to take place. Some hospitals are more expensive in cost than others, and it's usually based on the type of hospital that it is. For example, we take University of Alabama at Birmingham. We know that's a huge hospital, but we also know that UAB is a research hospital. Therefore, there are a lot more personnel that have to be hired in, and they have a lot more medical duties that they have to perform as well. So the costing for a hospital of that caliber or of that size is very high. Hospitals are organized based on the level of management within the hospital. Of course, you're always going to start with your administrative side first, and that starts with your CEO. This is the chief executive person. This is the one that actually makes the ultimate final decision for anything that needs to go on or take place within the hospital. He or she has individuals that work up under him or her in that particular department. Everybody plays a different role. Some places have COOs, chief operating officers. A lot of them have, you have your financial individuals. You always have a chief financial person, and then you may have one or two assistant chief individuals with them. A lot of times, the larger your administration is usually due to the larger your hospital organization. Most of the time with small hospitals, you have a administration department still, but it may not be as large as a huge hospital. There are some common categories within a hospital setting. I have the 5 listed for you. You have the administrative side, your informational side, you have your therapeutic services, diagnostic, and your support services. So we're going to look at each one of them very briefly. So when we look at the administrative services, as I stated before, these are your hospital administrators. Individuals like your CEO, vice president or presidents. You may have more than one. You have executive individuals that work, and then you have your department heads. And so when I mention the words department heads, I'm referring to a department head over the laboratory services. You have department heads over the nursing services, because with the nursing department, you have a head person like a chief nursing officer, and then under that person, she or he may have assistants. But then when you get to the different types of nursing departments, you have nursing managers, you have your shift managers, so you have a lot just within that one department by itself. The administrative side is the business side. Okay, so again, these are the individuals that operate or run the hospital. They have a lot of things that they have to oversee. Budgeting and finances are 2 of those main components, because they have to make sure that the hospital is able to stay up and running. They have to make sure that hospital policies and procedures and guidelines are followed, both by local, state, federal laws. And sometimes administrators have to perform public duties. So, like say for an example, if there's a new physician office that's coming, and it's going to be great for the community, and they need to get out there and put out public relations, let the people know that it's coming, a new service is being offered. A lot of times those are the individuals that go and speak on the behalf of the hospital facility. Okay, for the informational services, this is pretty much where departments such as your admissions department, you got your billing department, you have a medical records department, you have your computer information systems department. So that particular department is important because that is a department that houses, or shall I say, oversees all of the different type of softwares that it takes to operate with functionality in every department. For example, mostly everybody now has gone to electronic health records. Just about everything you do in the billing department is electronic. So these are the individuals that work behind the scene. Sometimes you see them, sometimes you don't. And their job is just to assure or ensure that reports are being printed, monitored as they should be, and you can keep the flow of the hospital operations going. The informational side also includes a health education department and, of course, human resources. So now, therapeutic services. Therapeutic services are those services that help provide treatments to patients. So that may be physical therapy, it could be occupational therapy, it can also be speech or language pathology. Those are not all of the therapeutic services, those are just a few, but therapeutic services within a hospital, and it's a beneficial thing because it's almost like, you know, you come in a hospital, you have a procedure done, you're there for 2 or 3 days, you had all your diagnostic services, and now while you're in the hospital, you also can have your therapeutic services there as well. Some other therapeutic services include respiratory therapy, you have medical psychology, you got social services, you have pharmacy. You have your dietary, that's a therapeutic service. You have sports medicine, that's one that you don't hear a lot about, and you may not see that as frequently in the hospitals. Most of the time, sports medicines are usually separate entities. They're separate from the hospital. They have a partnership with the hospital, but they're in a totally separate building, in a totally separate, different area. And then, of course, you have nursing. Now let's look at a few diagnostic services. So why do we have diagnostic services? Well, you have to have services that help doctors to determine what is going on with the patients. And that's where your diagnostic services come in. So some examples that I gave you in the slides. One is your medical laboratory department. Okay, these are all of the lab people. Those are the ones that come, they run the tests, they run the procedures, they collect the blood work, and they do a variety of other duties. And basically what their job is just to help be a special aid to the physician, to let them know, yes, this person has a UTI. Yes, this person has a kidney infection. Yes, this person has some kind of muscle weakness, or, you know, something going on with their liver, or something going on with their blood. That's what those individuals are for. You have your medical imaging department. This is your department where your x-rays are done, your ultrasounds are done, your CT scans, anything that the doctor needs to look at to see what's broken, what's inflamed, what's enlarged, what's not put together, what's upside down, what's twisted, what's swollen. That all comes to the medical imaging department. Then you have your ER, or your emergency medicine. Of course, we know exactly what that particular department is all about. You have your support services. Support services are those services that help to provide support in different facets of the hospital, or shall I say different departments. So some of the main ones that you have in the hospital setting, you have your central supply. This is where a lot of equipment and supplies come for the hospital in general. Most departments in the hospital, or just about every department in the hospital, plays a part in this, and they're able to benefit from the central supply department. You have biomedical technology. These are the individuals, most of the time they're males that work in that department. Their job is to make sure that your equipment is up and running and it stays functionality. Now, let me give you a little bit of a side note about equipment. There are some pieces of equipment that is not handled by the biomedical technology department. Some pieces are not. Some pieces are handled through whoever you're leasing the information, whoever you're leasing the machine from. Okay, so like for an example, in a lab, biomedical techs, they can work on the centrifuges and other smaller machines. But say for instance, when it comes to the chemistry analyzer, if I have a contract with Biorad or some other Siemens, say for instance, I have a contract with Siemens. Part of my contract includes maintenance, troubleshooting. So normally when I have an issue with that, if it's beyond anything that I can do as the tech, I usually get online and I call tech support and have somebody stationed to come out. My biomedical department at the hospital wouldn't bother that instrumentation. Okay, so anything outside of that, and it involves equipment, your biomedical department is for that. Housekeeping and maintenance, of course, their job is to maintain a safe, clean environment, not only for you as a employee, but also for patients and their families. So now let's kind of talk about what type of hospitals are known out throughout different areas, communities, or even hospitals that you may partner up with concerning your patients. Okay, so one of the hospitals is an acute care facility. Basically, it's just pretty much what it says. Anything that's all of a sudden, wasn't expecting it, may or may not need surgery behind it, we call that an acute care facility. You have general hospitals, St. Vincent's, Brookwood. These are just general places where patients can go if they need to have surgery and have to be in the hospital for like 2-3 days, or they need to have major surgery and have to be in the hospital for about a month or two, or if they've had a stroke or something of that nature and they need to have some care 24 hours for a significant amount of time, they usually go to a general hospital. Now, when I say a significant amount of time, we're talking about, a reasonable amount. So like, the patient had to stay in the hospital maybe a month or two or whatever, that's kind of pretty reasonable. But say for instance, it's long term, they got to be there 6, 7, 8 months. Usually you start looking at some other type of facility, such as maybe a specialized hospital, if that need be. But one example of a specialized hospital that I put in the notes was St. Jude's. That's the research cancer hospital for children. St. Jude is just one specialty hospital that I named. You have several other specialty hospitals. Like the UAB has a burn and trauma center. They have a spine rehab hospital. Then you have your rehabilitation hospitals. Lakeshore Rehab is one here in Birmingham. And basically these hospitals are designed to assist patients who've had some kind of trauma or disease going on with them, and they're trying to find a way to get back to the functionality part of their life, back to what they used to do. Then you have your behavior health, and anytime you see behavior health, those are the hospitals or services that deal with mental illness patients. Okay, now you have your not-for-profit hospitals. These not-for-profit hospitals, they depend on several things: sponsors, charitable donations, community-based. Their revenue for patient care is also a major support of operational, is a major source of operational support. Okay, so the way they stay operating, they depend on others to donate from different areas or from different organizations as a means of getting their revenue. For-profit usually have strong management structures. They have a much tighter control on nursing and support personnel. Usually their administrative cost is a little bit higher in overhead. They may not have as many employees, but they do tend to pay their employees higher wages. You have your VA hospitals, and of course, that's a hospital setting that's only designed for veterans, and those are the veterans that have served in the armed forces. Okay, so that pretty much ends the notes for Chapter 9, talking about the different types of hospitals. So we move over to Chapter 10. Chapter 10 is really short. This is a chapter that kind of talks a little bit about biomedical research. Here in the United States, we're like the leading country for biotechnology development by way of drugs, devices, medical and surgical procedures. So just to kind of give you one of the major interventions that took place for biomedical research was by a doctor of the name of Dr. Robert Jarvik. You may not know anything about him, so I put in the notes a couple of pointers about him. Actually, he was the doctor that performed the first artificial heart implantation, and he performed this heart surgery on Dr. Barney Clark. This was back in 1982 in Utah. So the heart that Dr. Jarvik implanted is now called the Cardio West. Okay, and it's used in a lot of transplant centers. It's pretty much like a bridge to human heart transplantation, and so he's well known for making this implantation, because this was a permanent heart that was actually implanted. So that's just a little side note for a historical invention that happened as it relates to biomedical research. When it comes to the drugs in the biomedical industry, of course, you know the FDA is the department, or shall I say the organization that deals with that. They not only monitor the safety of drugs, they also do the same thing for any foods and things that are consumed as well. Okay, so the Orphan Drug Act, basically this is the act that was established in 1983, and this act is was designed to make sure that the demand for drugs remained low, so that anyone within the population could have access to it. So in order for that to happen, you have to make sure that drugs are priced at a reasonable price, and also priced at a price where individuals can afford it, but at the same time making sure you capitate how much drug a person can get. So like, say for instance, Loratab. Loratab is one of those tablets. You don't want to make it so cheap in price where people have such a high demand for it, and it's almost like you're running out of it faster than it's able to be produced or replenished or supplied. So the Orphan Drug Act is the organization or the act that was passed to make sure that the low demand drugs remain available to the population in the event that there was a great need for it. Then you have your National Childhood Vaccine Injury Act. It was established in 1986, and basically it was designed to make sure vaccines were available for children that needed it, but also to make sure that these drugs are being manufactured and safe for for kids to have. And lastly, you have your medical devices. Basically, they're used to help assist patients with injuries and illnesses that they may have. Some examples include things such as wheelchairs, crutches, walking canes, hospital beds, the patient chair lifts, and certain types of hospital beds that may be used in the home, walkers, surgical dressings, prosthesis, orthosis, those are your artificial legs, artificial arms, anything that a patient can use that will help assist them with day-to-day activities. That's what your medical devices are used for. Again, FDA is the department that is responsible for reviewing these devices. They have to make sure that the devices are safe, and they have to make sure that the devices are effective for whatever the patient's needs are as well. So that concludes our notes for both chapters 9 and 10. This audio lecture will be uploaded to the student portal. And make sure that you look at your PowerPoint notes. They will be uploaded in DocSharing. There will be a separate chapter for chapter 9 and a separate set of notes for chapter 10 as well. Thank you.